Hi guys, welcome back to the online portion of our technology track. These next few modules we are going to key in on one of dentistry's simplest and most effective pieces of technology, the intraoral camera. Now intraoral cameras have evolved a ton over the last 20 years. They went from pretty big boxes that were tough to move around to, in today's world, pretty sleek little guys such as this one. Now there are many manufacturers out there, just like everything else in dentistry, but when you really narrow it down, a few cameras set themselves apart. We're going to focus in on one of my favorites. This one is the Iris by Digital Doc, and I'll let you know why. So first of all, as you're going to see popping up on your screen now, the Iris by Digital Doc has 5 different settings on it. It's got this great little wheel right in the middle of the camera. So F for full face is pretty cool. We've got an intraoral camera that takes an extraoral picture. Now the image that you're going to see when you're using the F or the full face shot is not as crisp as if you're using a $5,000 to $10,000 SLR, Nikon, or Cameron camera. But it's a terrific image if you're going to be loading your patient faces into your charts. And it's not a bad image at all for Invisalign. The beautiful part of using this kind of camera as opposed to a traditional camera is your team members will appreciate the size and the weight of this, and they're going to feel a whole lot better about using a camera of this nature than they will your very costly Nikon or Cameron. The second setting is S for smile. We can also take full upper or full lower arch images under the S setting. So it's great for 3 different images. Smile, retracted or unretracted, as well as taking a full maxillary arch from the occlusal view or a full mandible from the occlusal view. The next setting option is 2, which very appropriately takes an image of 2 teeth at a time depending on size. So obviously if you've got a couple giant molars, you may not get all of those 2 teeth in there. But if you have a molar and a bicuspid or 2 bicuspids or an anterior tooth, you're going to be in pretty good shape. From there we go to 1. You can see we're kind of narrowing in to get more detail, to get closer and closer to a tooth at hand. So 1 generally is going to take a picture of 1 tooth. Unless it's a small tooth, then you may capture, if you're taking a picture of a bi, a little bit of the molar and a little bit of the other bi, or a little bit of a bi and a little bit of a cuspid, depending on where you are. And the final setting on that dial is M for macro. So that's if you need to get real close to a tooth. Maybe you're trying to show a patient a fracture. Maybe you're trying to show them an exposure. Anything in the educational process where you really need to zoom in on a tooth, M does a great job. So I like this camera. That's the biggest and best reason Digital Doc performs well. The next great reason this camera is one of our favorites is the ease of use and the fact that it's really truly portable. So although this camera tends to be a little more pricey than some of the other competitors, the fact that it's a USB driven camera and I can have a port in any number of treatment rooms, pretty easy to use. Let me show you. So in my office, for example, we have 8 treatment rooms. We also on any given day can have 7 providers. So this cord hooks up to our computer system, USB Quick Connect. It's a couple $100. Pretty inexpensive at the grand scheme of things compared to a several $1,000 camera. These stay in every treatment room. This becomes mobile. And when I need it in my room, quick snap, and we're ready to go. Somebody else needs it, it's cleaned off, they bring it to their treatment room, quick snap, and we're back in business again. So, of all the camera systems out there, this is one of my favorites for those 2 reasons. It's got 5 different settings on it, and it's really portable. So despite the investment on the front end, it allows me to only handle 2 cameras in my office when we have up to 7 people treating patients at one time. Thanks. We'll see you soon.